Welcome. Thank you for being with us this morning. We are very pleased to be able to share with you that both Lakeland Regional Health and Watson Clinic are open for business. Our environments are safe, and we are well prepared to care for you and your family. We understand that COVID-19 has introduced an uncertainty in many aspects of our lives, but we want to reassure you that you can come to Lakeland Regional and Watson Clinic for your healthcare needs and be well cared for by our excellent team of clinicians. We have been so fortunate over the past several months to have just an outstanding team effort as we work to care for this community. On behalf of the entire executive leadership team at Lakeland Regional Health and our board of directors, I would first like to thank our incredible and awe-inspiring care team that's been working 24/7 at the bedside to care for both COVID patients as well as other patients that have been presenting to our facilities for emergencies. They are truly inspiring to all of us. But we know that we couldn't do this alone, and we'd also like to thank and acknowledge all of our physician groups and members of our medical staff in the community, including the Watson Clinic, the Moores, Riz, and all of the independent physicians. It was really them that worked alongside of us as we work to continue to care for the community. And then in addition, we have a number of community partners that we also would like to recognize and thank, including the City of Lakeland, Polk County, EMS, and first responders. It is through their support that we were able to work together to provide much-needed healthcare services during the last several months, and we anticipate that this will continue as we look to the future. And then we're also so appreciative of the community support that we've received. The businesses, individuals, and organizations that have come forward with generosity of donations during this time has really just been outstanding. I think at last count, we were just over 30,000 donated pieces of personal protective equipment. And we've also received over 6,500 meals for us to be able to provide to our team members at the front line. I'm very fortunate to have with us today both Dr. Steve Oppinger from the Watson Clinic, who's the managing partner, as well as Dr. Tim Regan, who is the Chief Medical Officer and President of the Lakeland Regional Health Medical Center. And they're going to be sharing with you more about some of the practices that we've implemented to ensure the safety of our environment and care team. As we look to the future, there are three main areas that I wanted to give you a brief update on as it relates to our preparedness and our ability to care for our patients, families, and the community at this time. The first is in our medical center. We are very fortunate due to the size of our medical center, which is the 5th largest hospital in Florida, and is comprised of 864 inpatient beds, which are located in 4 separate and distinct patient towers. And the layout of this campus allows us to have very separate and distinct areas to care for COVID patients, as well as those patients that are coming here for other healthcare needs. I know many of you have seen some recent interviews with Dr. Regan, where he also talks about the fact that we have very separate and distinct air handler units that allows us to have separate airflow for patients in these different locations. So this really allows us to have a separation that preserves the safety of patients coming to us for their care, as well as our care team members. This separation actually starts in our emergency department. Again, we're very fortunate to have such a large facility here with 133 beds in our adult emergency department spread across 11 pods, and then 33 beds in our pediatric emergency department spread across 3 pods. And each of those pods is able to be differentiated and distinguished for COVID care versus non-COVID care for those patients coming for a variety of other types of health conditions. And then should a patient need to be admitted, we have a new rapid assessment unit that allows the patient to be placed there, be evaluated, tested, and then have a determination as to which unit they need to be placed in to, again, ensure that the appropriate separation occurs along the way. The second area I want to touch upon is in our outpatient and ambulatory environment. First, I'm very happy to share today that the Lakeland Surgical and Diagnostic Center is open for business as well. They started doing cases on Wednesday this week in the outpatient arena. And I know both Dr. Oppinger and Dr. Regan will talk about some of the safety protocols and precautions that have been in place there. We also are excited to be able to continue our service of offering a dedicated respiratory care center. We were very purposeful when we opened our respiratory care center a few weeks ago to ensure that, again, in our off-site locations, we have a dedicated facility to be able to care for any patients presenting with respiratory conditions and potential COVID rule-out for evaluation, testing, and treatment in a very distinct and separate environment, allowing our other 9 ambulatory and off-site locations to continue to care for other patients that present with other medical conditions. We've had such an overwhelming response, treating over 350 patients at our respiratory care center, that we've been working in the weeks ahead to be able to relocate that operation to a facility closer to the medical center. Again, maintaining a separate facility for these services, but having closer proximity to the medical center so that we'll be able to take patients to a higher level of care should the needs arise during their time with us. And then the last area I want to touch upon today is the resources that we plan to make available to the community as we look to the future. Over the last several months, we've obviously learned a lot about how we maintain our operations, be able to take care of our team members while also continuing to treat patients for a variety of conditions. And we want to take what we've learned and make that available to the community, both businesses as well as educational institutions and other organizations. So we're very pleased to be launching the Lakeland Regional Health COVID Resource Center. This will be available online, and we'll also have a dedicated phone number that people can call and speak with one of our health ambassadors. The website will include implementation guidelines, checklists to ensure the safety of your environment as you all work in the business community and otherwise to get back to more normal operations. And then you can also call in and speak to one of our ambassadors that can help you with individualized questions or specific consultative needs that you may have. We feel as though the community's been so incredibly supportive of Lakeland Regional Health during this time that we want to be here for you beyond just the healthcare offerings that we have, but also as a resource as we begin to look towards the future in this current situation. So again, I'd like to thank you for being with us today, and I'd now like to invite Dr. Oppinger from the Watson Clinic up to the podium to share some of the efforts that are going on at the Watson Clinic. Thank you.
Thank you so much, Danielle, and thank you very much to the Lakeland Regional Leadership Team for inviting me to be part of this press conference. I think it just kind of shows how we're working together behind the scenes and in front of the scenes so that we can confront this crisis together as healthcare providers within the community. It's really heartwarming to see the cooperation between the two organizations, something that I hope will continue long after this crisis. I also want to thank our staff at Watson Clinic for working under difficult circumstances. It's awe-inspiring, as I put it, to see people who are willing to put their own home self at risk and face adversity without any kind of fear, and doing their job, doing their duty. It's very much appreciated, and we wouldn't be able to provide the care for the community without our hardworking and brave staff members. I'd like to update the community on on how we see the current situation at the Watson Clinic and what we are doing as we begin to reopen. Reopening is talked about a lot. Something that we are right in the process of doing currently. While we were never closed, mind you, Watson Clinic never closed any clinical sites. We continue to operate all of our facilities. We just were not allowed to practice, and for good reason, not allowed to practice everything that we do, which includes elective procedures and surgeries, which, even if they are elective, they are still very, very important. Anybody who's had an orthopedic injury, a painful injury, will know, while these may not be emergencies, they are still very, very important. They're important parts of your care, important part of patient wellness. So in the reopening, our main priority is the safety of our patients and the safety of our staff. So while we always take precautions to make sure that we can operate in a safe environment, there are going to be a few new changes because we are dealing with a different threat than we are quite used to. So we'll be detailing some of those steps that we take, especially as it relates to elective procedures in a minute. However, I do want to emphasize that it is a new environment that we're dealing with, and we've adapted in many important ways. At the clinic, we have been doing a lot of telemedicine, much more than we have in the past. And that's something that I think is starting to catch on in the community and could be something that may stick with us after this crisis is over. So that's been an interesting adaptation that our doctors have enjoyed and patients have enjoyed, being able to do that routine care from the comfort of your home without having to come out and visit the doctor. So I want to highlight what COVID-safe care looks like to us. COVID-safe care would mean that all patients and care team members are wearing masks as a precaution, kind of like this one here. It's not incredibly comfortable, especially if worn for a long period of time, but it's not incredibly fashionable either. However, it does serve an important purpose, right? And what does wearing a mask say? Wearing a mask says, I care about you, and I don't want to potentially infect you, because I know that I might be an asymptomatic carrier. I don't think I'm an asymptomatic carrier, but how do I know? So if we adopt a mask-wearing culture, that will help people feel comfortable wearing a mask. Sometimes people don't want to be the only one in the room with a mask on, right? That social pressure. So if we can kind of break through that as a community, I think that will help us all. So certainly in our facilities, we encourage the use of masks. We currently don't have the supplies to provide a mask to every single person who enters who would like to have one. So we do encourage patients to bring their own, be creative. Like in the room I'm seeing today, I see some creative masks, some pretty masks, well decorated. So make it a fashion statement. And that might be something that we just need to stick with for a while in the community. So not necessarily to protect the individual wearing the mask, right? This is to protect the entire community. Temperature checks, something that's going to stick with us, right? We're probably going to get used to this all throughout the community. We're going to be checking, we check temperatures. We have been checking temperatures of everyone entering our facilities, and that's going to continue. So, and if a patient doesn't meet screening criteria, either do symptoms or a temperature check, they'll be guided to one of our urgent care locations where we have the proper facilities to safely test and safely rule out COVID-19 infection and evaluate for that possibility. So that will be something that we'll need to stick with for quite a while. We've also segregated our waiting rooms in most of our facilities with sick and well areas so that we can reduce the chance of further spread of the illness. We follow all the guidelines from the CDC, all of our team members wearing masks and personal protective equipment that are appropriate to the situation, especially those who are involved in this COVID-specific testing themselves. We have a PhD for infection preventionist, right? Dr. Sue Karsinski. She's permanently on staff at the Watson Clinic and provides with us daily in the new developments in the pandemic and ways that we can continue to practice even better infection control policies. She shares changing guidelines, reviews all federal and state changes from the sometimes these guidance is coming from the Center for Disease Control, the Department of Health, the Surgeon General, our governor, even our local government. So she helps keep us on track with all of that new information. Now, specifically about elective procedures. As of May 4th, elective procedures are now allowed in the state of Florida, and we started on Wednesday of this week. Prior to the start of the surgery, something new, we are checking patients for COVID-19 infection. So that's a different type of test if you've never had it. It's not a blood test. It's a test with a swab will be inserted in the front part of your nose. So it is something that we're going to do on all patients prior to the test, prior to the procedure, for the protection of the patient and protection of the staff who are going to be working on the airway of that patient and putting themselves at risk of exposure. Provider and care team members assisting with the surgery will also be wearing gloves, masks, face shields, all the appropriate personal protective equipment. We're going to have to limit unnecessary personnel into the rooms where the procedure is being performed. So, family members, the drivers of our patients will be asked to remain in their cars or outside the building in order to help with social distancing. Our patients scheduled for outpatient surgery at Lakeland Regional Health will also have COVID-19 tests performed, but they will be performed at the hospital. For our Watson Clinic patients who are having outpatient surgery performed at Bartow Regional Medical Center will also be screened for COVID-19 infection, but this test will be run at Bartow Regional Medical Center. For our patients who are scheduled for outpatient surgery at Lakeland Surgical and Diagnostic Center, these patients will have their COVID-19 test run at the Watson Clinic main building. So we have 3 different locations for the COVID-19 testing, so that's something that maybe our patients will need just a little bit of getting used to. All this information is on our website and in the pre-operative instructions, but it's a little bit different than normal operating procedure. Again, I'd like to emphasize, it's very, very important to maintain your health during this time. Most of the people getting sick, most of the people with serious health complications during this time are not going to be related to COVID-19 infection. So it's very, very important that you get your heart disease, cancer, kidney disease, all other major medical problems taken care of during this time. Our facilities are safe to do that. I send my own family there. I myself go to these facilities, so they are safe. So we need to get back to taking care of ourselves as a community and making sure our health and well-being is served. Don't delay care. I think that kind of goes without saying, but we don't want to see someone have an unnecessary complication due to delaying care, waiting for the pandemic to pass. We're not exactly sure how long all these precautions and all these steps are going to be in place, but we have to plan on it being for quite a while. So don't delay your care and suffer a worse consequence because of it. Important request that we have, we'd like to ask the community to help us gain access to more readily available rapid COVID-19 testing. We currently cannot run tests in the outpatient settings that are available within hours to 24 hours, for instance. We are still seeing delays in getting these test results back. And as the economy opens up, as healthcare facilities around the state open up, around the country open up, there's a possibility that these delays will continue to worsen as the demand for testing goes up. So if we could have one thing that will help us operate a little better, it will be rapid COVID-19 testing. Also in the community is developing a culture of safety, mask-wearing culture, so that people, we just keep the spread of this illness to a minimum as we get back to our lives as close to normal as we can during these difficult times. Okay, now I'd like to introduce, that concludes my remarks, Dr. Tim Regan, Chief Medical Officer of Lakeland Regional Health.
Good morning. As Steve mentioned, my name is Tim Regan. I am the Chief Medical Officer of Lakeland Regional Health System and President of the Medical Center. I wanted to start off by recognizing the fact that we are in the middle of Nurses Week, and we should absolutely give a big thank you to all the nurses out there that are working on the front line and are putting their lives at risk by helping to care for this community. And with Mother's Day around the corner, that includes my mom, who's still practicing as a nurse. At Lakeland Regional, we have been blessed with the ability to work with the state of Florida, the Department of Health, as well as our local medical community to address this situation. We have worked hand in hand with Watson Clinic, with Mayo Clinic, with Nemours Children's Hospital, radiology and imaging specialists, as well as all of our independent providers in the city and in Polk County to help take care of this community. As the community opens up and as restrictions ease and people try to return to what is the new normal life, the community should understand that we will be relentless in our pursuit to provide quality and safe care at our medical center and in our physician practices. And there are a number of ways that we are trying to accomplish this. We recognize that people are scared. We recognize that the information can be confusing and conflicting sometimes, and that recommendations change from an hour-to-hour, or minute-to-minute, day-to-day basis. But we are going through great efforts to make sure that this community feels safe and that they can have their medical conditions cared for here without fear. So at the medical center here at Lakeland Regional Health, the community should understand that with restrictions easing, it will not change our approach to patient care. We will continue to wear masks. All of our team members will be required to wear masks. As Dr. Ackinger mentioned, this is not because people who are working here are sick. This is to protect the staff. This is to protect the patients. This is to protect the visitors. We are doing this out of an abundance of caution. We screen all of our team members every day when they come in. They have their temperature taken. They are asked questions if they are at risk. We are working to make sure and ensure that this community is safe to come to this medical center and to come to the physician practices. We also recognize that the emergency department people have been avoiding out of fear of contracting COVID. We understand that people have been concerned about coming to the emergency department and to the medical center out of fear of contracting COVID. We have been blessed with a large facility and a large emergency department. We have 133 beds in the ER. We have the ability to separate it into two distinct emergency departments based on risk for COVID. And in the medical center itself, with 864 beds, we have the ability to create two separate hospitals for people who are at risk and for people who are not at risk for having COVID-19. This community should feel safe to come here. We have gone to great lengths to ensure the safety of our community when they come to use our services. We've gone so far as to look at our air handlers and our ductwork for air conditioning, where people are breathing different air depending on what area of the medical center you're located in. In the emergency department, for people who do not want to come into a waiting room, we have established a call-ahead service. You'll be asked some questions, and people will meet you outside and take you directly to your room, so that you don't have the fear of waiting in a waiting room or sitting through the triage process. And as Dr. Ackinger mentioned, the governor has lifted the restrictions on elective procedures. I reiterate what he has mentioned about electives not being truly elective. These are cancer patients. These are people who live through chronic pain that need medical issues addressed. And so we are happy to continue to provide those services for people in the community. But there will come with some expectations. People will be screened when they come to our ORs, come to our endoscopy suites, and come to our cath labs. There will be a requirement that you are tested for COVID prior to being treated here. And we are working to make sure that that can be done in a very convenient way. But it should be the understanding that we have to do this to protect not only the patients and the visitors, but the team members themselves. On the testing front, Lakeland Regional has continued to work to expand our testing capabilities. We have adopted several new platforms as they become available and as they are researched as being medically feasible and worthwhile. Over the last several weeks, we have tripled our capabilities to test in the medical center and through our partnerships with Quest Diagnostics and with the Department of Health. We continue to work to the goal of testing all patients that come through our medical centers, and we will work to do that. We have several committees within the medical staff to evaluate continuously treatment options and protocols for COVID-19. As the world discovers how this virus can be treated, we will be updated continuously, and we evaluate how we can best care for people. Polk County and Lakeland should understand that when they come here, it will be the most up-to-date information that we will be treating you with. As an emergency physician, we have heard too many sad stories of people who are delaying medical care out of fear of developing COVID. People are putting off life-threatening illnesses, life-ending illnesses, out of fear of developing COVID-19. This is unacceptable, and this is a shame. People should know that we are going to great lengths to make sure that all of our patients are safe, regardless of the care they need. So we want to encourage the community to use the medical services if you need them, and you'll be safe to come. Thank you.
Thank you, Dr. Regan and Dr. Oppinger. And again, thanks to all of you for being with us today. We appreciated the opportunity to give you an update about how our organizations are COVID safe and here and ready to care for you and all of your healthcare needs. I believe we have a few minutes available for some questions and answers if there's anything from the audience that any of the speakers today could address. Yes, we can. Hi, Stephanie. Great. I'll ask Dr. Regan if you'd like to answer the question regarding testing protocol around our surgical patients.
Good morning. I believe I heard the question to be what treatment, or excuse me, what testing protocols will be put into place for our moms who are delivering. And we have acquired a rapid COVID-19 test that can be performed within 1 hour, and we have another platform that is in 3 to 4 hours. We have determined that we will require testing on all laboring moms as they come through, and depending on how urgent the situation is when we would use the rapid 1 hour test or the 4 to 5 hour test. The testing specimen collection is through the nose. It's a nasopharyngeal swab, meaning that it is a swab that goes into the nose. The saliva testing protocol we have determined at this point would not meet the needs to make sure that the teams and that the patients are safe. Well, I mean, we have to understand as a community that until a vaccine is available, or until what is described as herd immunity is achieved in the community, we have to assume that anyone out there is at risk. We will continue to evaluate the antibody testing. I know that this has received a lot of press recently to determine if people have been exposed. But as of this time, we have not adopted antibody testing for everybody because the testing platforms to this point do not meet the needs that we feel keep people safe.
Could you repeat the question, please?
What if the mom is defined to get the testing? You know, that has been few and far between that has happened. We want to really convince the community that we have to keep them safe as well as keep the team members safe. All of our team members are required to wear masks. We do have personal protective equipment for all of our team members, and we will address those on a case-by-case basis.
heads at the bottom of the plane on TV, friendly all. Can you either step up or bring that down to bring yourself better?
Is that better?
Yes, sir. To bring that down. He's got to raise the laptop. So that I look like a cartoon. It's not going to work on television, but it's better enough. So Stephanie's asking about women coming in having babies. I'm thinking about everybody's going to be tested, all people coming into the ER. You know, we have people who get shot by guns. What do you do in that situation? If you have to wait an hour. An hour takes a long time to make.
Understand. So all of the care teams are trained on how to use personal protective equipment. We look at testing as a way to ensure that everyone understands the situation that they are dealing with at any moment in a patient's clinical care. So if a patient is going to the OR due to a trauma that you described, the OR teams would know, even though the trauma team that is caring for the patient in the immediate acute setting may not have that ability to know. As of this point, there are no testing platforms that reliably tell you the condition of a patient immediately. I know that there are several labs that are working to that, but they're just not available readily at this point. And so, you know, the care teams understand that they may not know the patient's situation, and they have the equipment they need to care for them.
What was the tipping point where you made the decision, or someone made the decision, that everyone that comes to the hospital has to be COVID treated, or COVID tested to be treated?
Can you repeat the question?
Yeah, I'm just saying, I know that you said this in a terrible way, but why did the hospital decide that everyone coming in to be treated has to be COVID tested first?
I think as people understand that there are several asymptomatic carriers in the community that put team members and put other patients at risk, I think it's best to know the status of patients as they come and are treated here. I have heard other hospitals. We have been in constant contact with hospital systems within the region that are working towards this. We have all encouraged the state, encouraged the Department of Health to help us with this endeavor. And as of right now, I am not aware of any health system that is testing every patient. Correct. Yes, we are not testing every patient for COVID at this point. We are screening every patient for COVID at this point. That includes temperature checks, oxygenation levels, and questions as to their exposure to COVID.
When will you start testing everyone, and especially the moms who are delivering?
So as of right now, every mom that is delivering is tested. What the community needs to understand is, as Dr. Ackinger mentioned, testing kits, the available to test everybody, is limited at this point. Between the government, the Department of Health, there are hotspots that are getting priority for testing kits. And this is understandable in some way. However, we continue to look to them to help us be able to provide testing for every patient that we feel needs.
Doctor. So we're obviously moving into reopening right now under the governor's orders, phase 1 reopening statewide. Yet in Polk County, we've seen cases kind of escalate over the last oscillate over the last couple of days, and there's also about twice the state average in hospitalizations. So I was curious on your medical opinion on whether Polk is in a good place to reopen, and what indicators are kind of you're watching here at the hospital as to our status in Lakeland and Polk County with the infection.
The question that I'll
The
try
question is kind of what is our status here in Polk, and what indicators are you watching as a medical team to base your advice on as to what Polk County and Lakeland status is?
So the question is what the COVID status here is in Polk, and what, as a medical community, what we are looking at to make recommendations.
Correct.
Our approach has basically been to be ready for any patient that comes through the door. Despite lifting restrictions, patients may do whatever they want to do. And as the state continues to lift restrictions, we have to be prepared to care for the community. We are looking at testing. We are looking at those who test positive. We are looking at fatality rates. But at the beginning of this situation, we have worked to make sure that we are prepared for a massive influx of patients, and we continue to stay ready for that. We will assess that as we have testing capabilities to do that. There's no set date because we don't know when we will have the ability to do it.
You say do it, you're talking, when you're doing question.
I'm sorry. So the question was, when will you be testing every patient? And the answer is that we do not have the capability to do that at this time, but we do continue to evaluate the ability to do it as testing kits become available for us.
Dr. Hockinger, did you want to
What about
address
the
those?
dads that come with the moms that are delivering? Are they going to be tested too?
Just 1 second, Stephanie. I think we've got.
We're going to allow Dr. Hockinger to say a few words too.
Hello. I think the question about the dads coming in, that's more of a question for Lakeland regional leadership. But I'd be happy to answer any other questions about Watson Clinic operations and what our preparation is for elective surgery reopening.
Yeah, I was curious what you're keeping an eye on the outpatient clinic level with regards to what the infection status is here in Polk. Is it a closer eye on hospitalizations and deaths? Is it number of new cases? Because I know Polk's hospitalization rate is higher than the statewide average. We're still having an issue with nursing homes lately. That's a big competitive factor. So,
Yes, I think the answer is we're looking at all those. We're looking at all of the indicators. We have a daily COVID-19 task force call within our own clinic every day where we call through the available information. The Florida Department of Health website, if it's not used, it is fantastic. It gives incredibly detailed information. We are constantly tracking the number of visits to the emergency room with a flu-like illness, a COVID-like illness on a daily basis. It's just amazing the amount of information that we can follow. We are keeping an eye on the number of cases on a daily basis. The reopening, the White House task force, the home task force, had looked for 14 days of declining rates in their own reopening. Without looking at the data myself right now, I'm not sure, but I don't think that we're quite at that stage. But as you understand, reopening is not just a medical decision, it's a community decision. So as a physician leader, I want to provide guidance, I want to provide advice as best I can in a factual and straightforward manner. But ultimately the decision of how we open up is a personal one and a community-wide one. I think that we are expecting prudent planning for an increase in the number of cases that we'll be seeing. I think that just makes sense. But we do know that social distancing reduces the rates of transmission. So once we relax those, none of us stage here, if I can speak for my colleagues, I'll take the liberty of saying expect COVID rates to go down as we reopen. So we don't know what the spike will look like, if there will be a spike or will it be a slow, steady stream. But we're preparing for either. So those are the markers that we look for. We look at our own in-house numbers as well, but since we aren't getting all of the data, it's much better to look at the Department of Health's overall numbers. We have noticed, as you mentioned, the increased hospitalization rate, and not 100% certain why we have a higher hospitalization rate. Are we missing outpatient testing? Are we missing asymptomatic cases? Or are we just having more difficulty because of situation is within Polk County. I don't think I know the answer to that, but I think it'd be one of those two would be the best explanation.
What are you doing at Watson Clinic? I know you had screening for temperature tests and you asked a bunch of questions because I've been up there myself a lot lately. But the waiting rooms are full up there now with these elective surgeries that are now able to take place. So what mechanisms are you all putting in place to make sure that social distancing can actually be achieved? Are you limiting the amount of people coming in for appointments or?
We're currently not limiting the number of people who come in for appointments. We are encouraging mask wearing, as I mentioned earlier, among patients, family members who do come in. We are, where feasible, keeping those in the waiting room 6 feet apart. However, I think all of our facilities, sometimes the social distancing is just not possible to achieve. But that's where wearing the masks, I think, can be helpful. We're doing our best to segregate sick from well through screening patients at the door. But we do, I think, if individual family units social distance from each other within the waiting areas, that's extremely helpful. We're getting at that balance. We don't want to keep people from getting the care that they need because they have to be within 5 feet of somebody else, whereas they could be 6 feet. So these are guides that we attempt to achieve in everything that we do. We also understand that we have to provide the care that people need out there. There's a lot of pent-up demand for important procedures that are elective in nature, and we don't want to be triaging that care by being overly restrictive at the door.
Lakeland police on this before, and Danielle had mentioned, or someone mentioned that there's going to be a COVID resource center. Is that something that's in the planning? And if not, below, if it's ready to go online, what would be the website? And if we can make a call, what would be the number? Why don't you people practical info one?
Absolutely. The question was regarding our LRH COVID Resource Center, and it is available on our website, mylrh.org. In addition, the hotline phone number you can call is 863-904-1859. Yeah, and I think we have time for one more question. If there's anything else that anyone would like to pose. Yes,
I'd like clarification on masks because strangely there are conflicting reports of that. First it was it protects you and the people around you. Now they're starting to say, oh, it really doesn't protect you, just the people around you. So I hope one of the doctors could give the real word on that.
Sure. Rob, for those on the line, Rob was asking a question regarding masks and kind of what the answer is with respect to who's being protected. And I think the general answer is it depends on the type of mask that you're wearing, but I would certainly turn it over to one of our physicians here to speak to that in more detail.
Yes, you're right. The guidelines have kind of changed a bit on mask wearing over time, and it does get confusing. The World Health Organization continues to, I think I said that. It depends upon the type of exposures you're anticipating. If you are anticipating to be in close contact with a patient with COVID-19, you certainly cannot social distance from, and you're going to be perhaps performing a procedure involving the airway. This is one of the highest risk situations possible because you're actually going to be stirring up respiratory droplets while performing the procedure. You must protect yourself from respiratory droplets in that particular setting. So that's an example of the highest risk of exposure. Now that's mostly occupational, and that's where you definitely need to have an N95 mask and have it fit tested for it. And you want to perform your procedure safely, but if you can perform it more expeditiously, all the better, right? You want to reduce the time that you're exposing yourself. You want to wear the proper protective equipment. So if we look at potential exposures that are a little less risky than that, then we can kind of talk about where other masks might play a role. This surgical mask won't protect you from the aerosolized respiratory droplets that you could inhale, because it's not forcing all of the respiratory droplets to go through a filter in the mask. Air is getting in around. So if you were going to be in close contact with somebody with the illness, or potentially having COVID-19, again, you want to use an N95 mask. That's going to be your best bet, because that's going to be the safest approach. If you don't have an N95 mask available, this World Health Organization does state that this will provide some protection, but not all. I would not encourage any member of the community to use an N95 mask, however, because it's very, very important that these be reserved for healthcare providers who are putting themselves at most risk. Our nurses in the intensive care unit, very, very important for them, wise for them to do that. So I don't think that N95 masks are something that the community needs to be concerned with. So if you're worried about exposure and you're out in the community, you just want to spend as little time around it. Reduce the time on the exposure. That's probably the most important thing. Wearing a small mask may help you a little bit. But as you alluded to, we do believe that the best benefit for the community to wear masks is to reduce the spread of respiratory droplets that you are putting in the air around you. And so that's where developing a mask wearing culture, I think, will give us the most bang for the buck as far as community spread of the disease.
Thank you. Thank you, Dr.
All right, thank you again, everyone, for being with us this morning. We do appreciate it.